How can I improve the results of a facelift?
A facelift is one of the biggest investments you can make to enhance your appearance. Typically performed by specialty trained doctors, facelifts are performed in operating rooms with a team of people in addition to the surgeon over the course of several hours. With so much time, resources, and money spent on a facelift, why are there people who are disappointed with how they look after facelift surgery? I'll discuss what kind of results should be expected from a facelift, as well as the facial aging issues that a facelift alone does not address. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I routinely perform all types of facelifts, from short scar mini lifts to more extensive deep plane or sub-SMAS facelifts. I often perform a combination of face and neck lifts for people who are more advanced facial aging. Since facial aging also affects the appearance of your eyes, I often perform eye rejuvenation, such as upper and lower eyelid surgery at the same time. In many of my facelift surgeries, I make it a point to address the volume loss of aging seen in the lips and facial support structures through strategic placement of selected hyaluronic acid fillers to enhance the lips and vertical lines, in addition to the cheekbones, chin, and jaw angles. One of the core principles in my practice is to first define the problem before determining the optimal strategy to reach a solution. It's therefore important to first identify what specific problems can be addressed by a facelift. A facelift involves the surgical restoration of the cheeks and jawline soft tissue, which has become loose and descended downward due to facial aging. These anatomic features are not just skin, but they exist in layers, which include the skin, soft tissue, and the connections to the deeper facial muscles. The connection to the deeper facial muscles is often referred to as the muscle, and is referred to in our profession as the SMAS, which stands for the superficial musculoaponeurotic system. The SMAS serves as a critically important foundation for the skin to be supported by. Skin-only lifts and procedures such as thread lifts do not have the level of support of a properly performed facelift and consequently don't work very well. As I mentioned earlier, aging changes are not limited to the cheeks and jawline but also affects the eyes. For example, aging can cause the upper eyelids to appear hooded or sagging, as the skin above the eyes stretch and become redundant with age. The lower eyelids can also have a puffy appearance, which is often referred to as eye bags. Puffy eye bags are due to fat that is normally around the eyes prolapsing forward. Combining eyelid surgery with facelift surgery is something I recommend to help you look your best as a combination when appropriate. The recovery time overlaps the facelift surgery and you get the most value out of the cost of the operating room facility and staff in our office. There are two important factors in facial aging. One is the descent of the skin and soft tissue, which is addressed by facelift surgery. The other is volume loss at the bone and soft tissue level. Youthful facial volume can be appreciated by the fullness and projection of the cheeks, the jawline definition, and the overall facial harmony seen in a younger person. Many facelift patients often report that they really like their results during the first few months after surgery, and then they feel like their facelift doesn't look as good after 1 year. This is a misconception since during the early recovery period, the swelling, which is temporary, can create an appearance of having more youthful volume. As the healing process progresses, this temporary fullness caused by swelling disappears. So how do I address your facial volume deficiency if I'm performing your facelift? As a surgeon, I have used two strategies in the past to help my patients. One was to place facial implants made of silicone, such as cheek and chin implants, at the bone level. The other was to harvest fat and perform fat grafting. Patients often resisted having facial implants in fear of looking overdone. They were generally willing to have a small chin implant, but often objected to having cheek implants. I found myself concerned about two things with the placement of cheek implants. One was whether the patient would be satisfied with the outcome, or would they feel that the shape wasn't what they wanted, or if the implant was either too small or too large. The other concern for me was whether the patient's thin skin would eventually or at the same time reveal an outline of part of the implant, particularly as aging continued and bone loss and skin thinning could make the implant appear more visible. Further, if the patient wanted the implant to be removed, it means they have to undergo another surgery. I also try to enhance the facial soft tissue loss with fat grafting. This involved my performing liposuction and taking the fatty tissue and placing the fatty tissue into the areas of facial volume deficiency. Unfortunately, the fat survival rate was too unpredictable and patients needed more surgery in order to try and restore the lost volume from the first surgery. In addition, aged skin is intrinsically thinner and weaker than younger skin. This means that whether it's fat or filler, the skin has a limited weight-bearing capacity. I made a significant paradigm shift in my approach to facial volume deficiency several years ago. This was the result of a synergy from combining the principles of facial implant surgery with the technological advances of recently introduced thicker and longer lasting hyaluronic acid fillers, such as Juvederm Ultra Plus and Juvederm Voluma. I place these fillers without surgery, using blunt cannulas at the bone level of the cheeks, jawline, and chin. I cannot overstate the importance of technique. Many doctors and so-called injectors believe that if their needle contacts the bone, that they're at the bone level. The needle may be touching the bone, but the filler is generally not going where they intend the material to be placed. While facial fillers have a reputation for appearing doughy and unnatural, I use my knowledge and experience as a facelift and facial implant surgeon to precisely place filler at the bone level below the facial muscle layer, which results in a more defined and sculpted appearance. I call this technique structural volumizing because it adds structure and definition to the face. As I mentioned earlier about technique, I use very few entry points to place the hyaluronic acid filler, so bruising is rarely an issue. Many of the so-called master injectors do demonstrations on social media platforms with needles piercing the skin multiple times in just one small area, only to be repeated several times more for the other areas to be addressed. That's a lot of poking, which means more swelling and more bruising. By performing structural volumizing, I'm able to be much more precise with volume and shape, allowing me to make micro adjustments for asymmetric features. Unlike a facial implant, which would require additional surgery should there be a need to reverse the filler, all I have to do is use an enzyme called hyaluronidase in my exam room and the filler is completely dissolved. I routinely use structural volumizing for people who've had facelift surgery performed by other surgeons who want to look better. These patients are often delighted to learn that they don't need another facelift and are very impressed by how good they look in less than 30 minutes in my exam room. If you're considering a facelift, you clearly care about your appearance and you expect to look significantly better afterwards. While facelift surgery is effective for lifting sagging cheeks and jowls, I counsel my patients about facial volume loss and the appearance of their eyes and lips when planning a comprehensive treatment strategy for them. My patients appreciate this integrated approach by me as their beauty doctor. Rather than having to go to multiple people for different services. Whether I address volume at the same time as a facelift or afterwards, restoring structure improves the balance and definition of your face in a way that completes the intended outcome of a beautifully performed facelift. I hope you found this information helpful. Thank you for your question.